Thank you all for joining us today for our weekly COVID-19 briefing. Today I am joined by Monroe County Public Health Commissioner Dr. Michael Mendoza, Dr. Nana Bennett from the Finger Lakes COVID-19 Vaccine Hub and the Finger Lakes COVID-19 Vaccine Task Force, and Wade Norwood, the CEO of Common Ground Health and also a co-chair of the Finger Lakes Vaccine Task Force. Before we hear from them, I want to start by giving an update on metrics and trends and a few announcements that we have today. So first, let's take a look at our metrics as we usually do. Our downward trend does continue this week. So we have graphics to share. There we go. All right, our downward trend does continue this week. Today's 7-day average of new positive cases is 127, down from 139 during our briefing last week. The total new case reported today is 142. Wednesday stood at 109, and Tuesday's 99 new daily cases marked the first time we were below 100 new daily cases since November 3rd. But again, I remind you, look at the trend lines. You're always going to have a little up and a little down. What we like to look at is trends. And so we look at the 7-day rolling average, which is down to 127. Our 7-day positivity rate is down to 1.6% and has been steadily below 2% now for the last 7 days. So we take that as a good sign. Our hospitalization and ICU numbers continue to improve greatly. As of yesterday, there were 181 people hospitalized in the Finger Lakes region, 53 in the ICU. Those numbers are down from last week's briefing. If you recall, we were at 225 at this time last week with 68 in ICU. Today we're down to 181 with 53 in the ICU. The positive trends in our numbers continues, I think, to be a testament to our community's vigilance. They serve as a reminder that the safe choices that we are making today, along with our continued vaccination efforts, are bringing us one step closer to the end of this pandemic, getting back to life as we knew it. And I really do want to thank the community for coming together and working together to mitigate the spread. One thing I do want to add about that is, for all the different reasons why it's important to keep our numbers down, is to protect ourselves, protect our families. It is also to protect the hospital and healthcare systems and the workers there, so we do not overwhelm the hospitals and the healthcare systems, so we can treat all patients that are here in our region. This is a theme and something we talked about from the beginning of the pandemic. And I do want to take an opportunity to thank all of those incredibly hardworking men and women who work in the hospitals and the healthcare system across Monroe County and the region. You know, earlier last year, we showed them an incredible amount of support and thanks and gratitude at the beginning of this pandemic, when our numbers were actually low compared to where they were just over the last few months. But over the last few months, they went through an incredible ordeal in the hospital. The hospital numbers were very high, if you recall, back into December and January, at a time where our healthcare workers were away from their families, putting their own health and safety at risk to be in the hospitals, working long hours where there was very little relief, while other healthcare workers were getting sick as well, and forcing our employees to work double shifts, triple shifts, and around the clock to keep us safe and make us healthy. And I think on behalf of an incredibly grateful community, I just want to say thank you to the healthcare workers who have just done an incredible amount of work. And I just want them to know how much we love and appreciate them and appreciate their families as well for giving up their loved ones' time and effort and energy on behalf of the community. So I just want to say thank you. Now that we are more than 2 months into our vaccination efforts in Monroe County and the Finger Lakes region, our combined efforts continue to expand every week. As of yesterday, New York State is reporting that 129,000 of Monroe County residents have received at least their first dose of vaccine. 74,851 have completed their vaccination series, meaning they've received both the first and second dose. The vaccine efforts are ongoing at the Rochester Riverside Convention Center and at the Fleet Center Pod. This week alone, Monroe County received, this is just the Monroe County Department of Health, not all our partners, but the Monroe County Department of Health received 7,500 doses of vaccine, which will be administered to individuals with the comorbidities, essential workers, including school staff and grocery store employees, and to residents who are 65 and older. To date, 20,268 people have received their first dose of vaccine, and 13,066 have received their second dose of vaccine through the Monroe County Department of Public Health and our county vaccination efforts at the Convention Center, Fleet Center, and Westfall Road. We also reached a new milestone this morning at the Convention Center. Our pod at the Convention Center administered the 10,000th first shot at right around 10 a.m. this morning. So I just want to, I say it every week, but again, want to thank the team. This was really a team that crossed every county department and out into the community. Tremendous effort by our staff, working long hours and adjusting really on the fly to accommodate changes to the vaccine allotments, operational hours. As we discussed, we were usually notified week to week of how much vaccine we have, and being able to mobilize and move that fast to get this much vaccine out every week is an incredible operation. And again, on behalf of the county, I want to thank the whole team here for making that happen. To piggyback on that a little bit, as I mentioned, we do have Monroe County is vaccinating residents who are 65 years and older. We have an allotment for that. There are still appointments available on our website for today and tomorrow for residents who are 65 years and older. If you go to www.monroecounty.gov, you can click on a link and sign up for one of the appointments. Again, there's appointments available today and tomorrow for older residents who are 65 years and older. At least right before this press conference, they were available. So let's make sure we get the word out that those are available today. Also, Wegmans, another exciting partnership kicked off today. Monroe County is partnering with Wegmans, the City of Rochester, and the Greater Rochester Chamber of Commerce to vaccinate public-facing grocery store employees. These are employees who have been on the front line throughout the pandemic, playing an important role in providing goods and services to all of our residents. The initiative is not just for Wegmans employees. It's for any grocery store employee in Monroe County. The cities of Rochester's neighborhood service centers will be helping us contact convenience store and bodega employees within the city. We've allocated 30% of the vaccine appointments to be scheduled through the neighborhood service centers. The Greater Rochester Chamber of Commerce, led by Bob Duffy, will be working to identify and contact any non-city independently owned grocery store or convenience store so that they're aware of the initiative as well. I want to thank Wegmans for coming to the table and stepping up to do this, not just on behalf of their own employees, but all grocery workers across Monroe County. This was a wonderful service that they agreed to participate in. Our first clinic was held today. Monroe County is hosting the link. We will do these each week depending on our allocation. The link will be posted every Monday at noon for grocery store employees and will remain live until the appointments are filled. We're hoping and expect to be able to allocate between 300 and 400 doses a week. So again, every Monday at noon, the appointment will go live on the Monroe County website, and for grocery store workers that will be vaccinated at the Wegmans Conference Center. Lastly, before I turn it over to Dr. Mendoza, I again want to remind everyone of our free rapid testing locations. We have a new location in partnership that starts tomorrow at Mount Olivet Baptist Church on Adams Street in the city of Rochester. The location will be open from 3 to 6. This is a really great location because it offers drive-up testing capabilities and service, which I think greatly enhances the convenience for residents. All along our updated schedule, registration link will be live every Friday at noon. So Friday tomorrow, next week's testing sites will go live. But we still have availability tonight in Irondequoit and at Temple Beth Kodesh. Tomorrow is the Mount Olivet site, and Saturday is at East High. I remind you, registration is not required, it's recommended, but I encourage all residents who would like to be tested. The whole thing takes about 15 to 20 minutes to get your result back. The test is very simple and easy to do. So with that, I turn over to Dr. Mendoza.
Thank you, County Executive Bello, and thank you again to all of our media colleagues for sharing this opportunity with us. I wanted to pause. We are at the 51st week of this pandemic here in Monroe County, and next week we will be recognizing 1 year of the COVID pandemic here in Monroe County. I think it's important for us to pause and reflect on all that we've been through. Next week, we'll pay tribute to those who we have lost in this community due to this pandemic. But today, I want to focus on a message of optimism. First, it's that things are beginning to change. Things are beginning to improve. Things are beginning to reopen in all the ways that we have been longing for many, many weeks and months. Two specific examples. Number one, for those who are traveling, if you have been fully vaccinated and it's been 2 weeks since your second dose of either the Pfizer or Moderna, or 2 weeks after the Johnson & Johnson when that comes online, you will not need to be quarantined if you've been a close contact of somebody with known COVID infection. In the same spirit, for those who are traveling, if you are traveling and you are coming from a non-contiguous state, the travel advisory is going to be updated such that you do not need to quarantine upon arrival back into New York State if you've been fully vaccinated. Again, 2 weeks since your second dose of the first two vaccines, or 2 weeks since your only dose of Johnson & Johnson when that comes online. And on the note of Johnson & Johnson, earlier this week, we learned of a now third vaccine product that is received early emergency use authorization approval from the FDA. The Johnson & Johnson vaccine is a different type of vaccine than the Moderna and Pfizer. It acts in somewhat of a different way, but at the end of the day, it is equally as effective. A lot has been speculated about the differences between these vaccines, and the primary difference between these vaccines is that the Johnson & Johnson is a one-dose vaccine. There is no need for a second dose at this time for Johnson & Johnson. But when you look at the science, the studies were done a little bit differently, which makes it a little bit more difficult to compare them one against the other. But when you look at the outcomes, they are equally as effective at preventing COVID-related death, COVID-related hospitalization, and COVID-related serious illness. So when Johnson & Johnson comes online, which will be very soon, I want to encourage everybody to consider that as an equal alternative to the Pfizer and to the Moderna shots. On the topic of our vaccination efforts, a lot has happened again. We're here in week 12. We've received about 7,500 doses just here in Monroe County's Health Department. Some rough estimates of where that vaccine was allocated this week. About 60% of it was allocated to individuals who are 65 and older. We're really trying to focus on our older population here in Monroe County because we know that they are at greater risk than younger individuals. Also working on safety net practices. About 15% of the vaccine was redistributed to safety net practices who are primarily working with, although not exclusively, communities of color and in our inner city. Essential employees, 20%, and individuals 18 and above with those medical comorbid conditions that we've talked about, approximately 4%. So that adds up to roughly all of the 7,500 vaccine doses that we received here this week. Now, earlier today, you probably are aware that Rochester Regional Health has identified a new mutation in 4 cases of individuals who are COVID positive in their system. I was made aware of this late last night, and we are working closely with the State Health Department and the Wadsworth Public Health Laboratory to understand what the meaning of all of this is. We're still early in our investigation, but what I will say is that this, for now, does not change anything about what I'm advising, which is to continue to do everything you can to wear your mask, to follow the usual physical distancing requirements, and to get your vaccine as soon as possible. You'll recall that the presence of a variant would be a cause to reevaluate our recommendation that higher risk sports would be permitted in Monroe County. So once we get final information from Wadsworth and final confirmation of what Rochester Regional has identified, we will take that back and work in partnership with the State Health Department to determine if any modifications need to be made with regard to higher risk sports. And finally, I want to end with another exciting announcement, which is that earlier this week, the Reopening School Safely Task Force, headed by Common Ground Health across a collaboration in this community, issued our interim report. We are all on the same page. We want to reopen schools safely. And the report highlights all of the wins that we've had and a lot of the work that we have yet to do. But I do want to reiterate, we all want to reopen the schools as safely as possible. As before, I've been working very closely with school superintendents, public schools, charter schools, private schools, to get ready for that day if and when the state changes their guidance and it makes it possible for us to reopen our schools safely. So with that, I will hand it over to Mr. Wade Norwood.
Thank you very much, Dr. Mendoza. And I'll just use my time to try and strike the same note of optimistic celebration, of cautious temperance of that optimism, and of the message of stay the course that you just provided, Mike, by spending my time, first of all, thanking this community and the partnership that has been represented by the more than 80 organizations that make up the local regional vaccine task force for the incredible collaborative effort that has gone into supporting the opening of the FEMA New York State vaccine clinic at the Kodak Hawkeye site. As a diagnosed hypertensive and diabetic who lives in zip code 14611, I am registered and scheduled to have my first vaccination tomorrow afternoon. And I think that it is, as I have said before, a game changer in terms of making sure that the vaccines that protect against the coronavirus are available in an equitable manner to all of us who are the residents of the Finger Lakes region. I especially want to thank you, our region's media, for the incredible coverage and support that you provided to the launch of this site and to the efforts by the county, the public health department, the vaccine hub, our hospitals, clinics, our community-based organizations, the city government, and our faith-based organizations, and the many concerned neighbors in this region who have spent the last week helping to spread the word about this clinic and to support registration of other neighbors of ours to be vaccinated at this Hawkeye site. Let me specifically note my appreciation for the city's 311. It's our centers and libraries joining with community-based organizations to make sure that there is support and assistance for the online sign-up required to make this site as successful as it has been. I want to acknowledge the telephone outreach, the more than 80,000 postcard mailings that went out, the incredible support that we received from the Regional Transit Service to make sure that transportation barriers could be addressed, to our friends at 211, and particularly the United Way, which made their volunteer portal available for us. And over 100 of our neighbors spent Saturday and Sunday and Monday going door to door in the heart of the city, passing out over 20,000 pieces of literature, talking to hundreds of our neighbors, registering dozens right on the spot. And we covered 80% of our target area in this door-to-door effort. Deeply appreciate those of you who have been covering it because of the fact that it was a significant contributor to the fact that, as of the most recent numbers I saw, over 13,000 of the 28,000 appointments were advanced booked by our community. The signups for that site doubled on Sunday and Monday as a result, I believe, of the incredible collaborative effort that all of the organizations I mentioned have been a part of. And I am deeply appreciative of the fact that the state has made a commitment to keep some of the remaining appointments in reserve to make sure that we protect this effort to drive up and achieve vaccine equity. I'll end my remarks by just noting that we are in March. This is still the opening moments of this campaign to make sure that we achieve equity. There is much more work that needs and remains to be done. But I am incredibly confident, as is Dr. Mendoza, that if we who are eligible can be ready to respond when vaccine becomes available. If those who are not eligible can continue to help us spread the word of how important it is that those who are eligible make their way through mistrust and misinformation to receive the vaccine. And if we remain masked, social distant, and if we can continue to spread the message of health and protecting each other, I am confident that we will emerge from this not only not less, but better than when we entered into this pandemic state. Thank you very much. Back to you, Mr. Nana.
Thank you, Wade, and good afternoon, everyone. I thought I'd give you a little bit of news from the region to put the Monroe County context. But first, I wanted to thank all the vaccinators in our region. In addition to the thanks that Wade shared and Adam and Mike, I need to say that the people who are actually delivering the vaccine on the ground have just been doing an incredible job. And in addition to vaccinating tens of thousands of people, they also have been dealing with just an incredibly complex system and having to respond very, very quickly to different changes and different allocations and different eligibility, and the list goes on and on. And so we're very, very thankful to them. And we're also thankful to you all in the media for helping us to spread the word about all of these efforts and also helping the public to understand exactly what's going on behind the scenes. This week was an amazing week. We, for the first time, received almost 40,000 doses of vaccine in our region, and that brings our total allocation to over 200,000. So by the end of this week, we will have vaccinated about 20% of our total population in this region. This is huge cause for celebration. We are really feeling like we're seeing the light at the end of the tunnel. And all of the efforts that my colleagues have described have gone into this. The Dome has increased its capacity to 1,900 vaccines per day. The Hawkeye facility has brought a great, really robust infrastructure to the city. There's now going to be a special clinic in Batavia that will extend our reach to some of the surrounding counties. And this weekend, there'll be 2 pop-ups, one in the city of Rochester and one in Livingston County. All of these efforts are just unimaginable a few months ago. And we are just so grateful that everyone can work together to make these happen. The idea that we might see the end of this by May or June or July is really incredibly exciting. And this is the first time we've really been able to feel that hope about that end date. And all of this is before Johnson & Johnson. And Johnson & Johnson is a game-changing vaccine because it only requires 1 dose. We're anticipating some Johnson & Johnson in the next week or so. There may then be a bit of a lull, but then we will see an ongoing supply going forward. So our estimation that we can get to the end of our population by June and vaccinate all the members of our community is a fairly conservative estimate based on the number of doses of Pfizer and Moderna that we received this week. If we receive large amounts of Johnson & Johnson going forward, we will be done even faster. So lots of reason for hope. I think we started with reflecting back on what this year has meant to all of us. Dr. Mendoza reminded us it's been almost exactly a year. I think we can look forward with great hope towards the summer. And with that, I'll end my comments and be willing to answer any questions, as I'm sure we all will. Thank you.
Okay, our first question comes from Emily Putnam at WHEC.
Good afternoon. Can you hear me okay?
Yes, we can.
Excellent. As always, County Executive and Dr. Mendoza, thank you for taking the time to talk with us today. You know, we've heard the governor and the president emphasize the necessity of prioritizing teachers when it comes to the vaccine rollout. And we're hearing more and more school districts talk about reopening for in-person instruction 5 days a week going forward. At this point, how many teachers have been vaccinated in Monroe County? And what percentage of vaccinations in Monroe County have gone to teachers?
We have asked the schools to provide to us statistics on the number of teachers and staff who have been vaccinated. You may recall that last week, I think it was, the governor instituted an executive order that now requires the schools to report those data to us here in the health department. And so we're working out the system to do just that. And we plan to go live with that next week. But from the selected districts, and I can't remember all of them off the top of my head, the numbers are actually quite reassuring. You know, I'm hearing numbers of well over 50%, and in some cases 70 to 80% of teachers have already received their vaccine. So when the final numbers come in, we'll be able to share that. But what I will say is that the number one driver, you know, and if you look at the CDC guidance, the number one driver in our community that would make reopening schools safer is the new cases per 100,000 over a 7-day average. Our positivity rate has been low, even though our test volume has remained constant. So what we need to do is make sure that that new cases number goes below that threshold in the CDC guidelines so that reopening schools can be considered. Now, as you all know, this all depends upon changes at the state level, but we are advocating for that. And we are optimistic that things will change. And when they do, we want to follow the science and follow the CDC guidelines that talk about how 6-foot distancing can be addressed depending on the level of community transmission that is measured in a particular community. So we're really not looking at a percentage of teachers being vaccinated as giving a green light, if you will, to reopening schools. We certainly want our teachers, just like everybody else, to be vaccinated. But what we're really focusing on is that community transmission rate, because, you know, hypothetically and realistically, if there are very low cases of COVID in the community, then that vaccination, the impact of vaccination isn't going to be as great at first. So we want to get everybody protected. We want to keep that level low. But when it comes to looking at schools, we're really looking at community transmission as being the primary driver.
To follow up, are there any plans to hold a vaccine clinic in Monroe County specifically for teachers going forward?
Yeah, so each week, well, the way we do with our allocation, each week we get allocations from New York State that are designated for different populations. We call them like the lanes that we're all operating in, right? So this week we had so many allocations for essential workers, for people with comorbidities, and another one for people 65 and plus. And what we've been doing since we received the essential workers is allocating a certain portion of vaccine each week in a closed link and closed pod system to employees at the school districts. We'd have to get back to the exact number that we've done to date through that, but we've been doing that consistently all along, using the closed pod system and the link to make sure that there's a dedicated supply to educators.
Okay, our next question comes from Atia Collins at WROC.
Good afternoon. My first question goes to Dr. Mendoza. It's going to be about the variant. I'm wondering, I know you said it doesn't change much right now, but I'm wondering, are we in a position where we are now testing for the variant in our population, or just exactly what is the risk we're looking at?
Well, as I said before, there's no reason to think that the variants have not been in our community for some time. We have been testing, and it was only a matter of time before we were able to isolate it. They are relatively rare, but the way the process works, whether at U of R or at Rochester Regional, there are specific techniques that they utilize to identify specimens that should be tested. So we don't test we don't sequence every specimen that goes through, but they have ways of looking for specimens that may be one of the variants, and so that's how these were identified. As I understand it, they have not indicated that these are variants. They're saying that these are mutations that may be associated with variants, but they are still looking into this further to see exactly what this means. From my standpoint, this does not change any of my guidance. This does not change the importance of getting vaccinated. The vaccines have been shown to be effective against the new variants. So I do not think there is reason for alarm. I think it's a reminder that we all need to keep doing what we're doing and keep our eye on the prize. But the news of these mutations today does not change me significantly.
my follow-up question is just for Mr. Norwood. A lot of people were calling, or some lawmakers were calling for an extension on the limitations at the Hawkeye site for city residents, the zip code limitations that were open to only city residents. That was only open for a week, and then it went to all zip codes in the county. I just wanted to ask your opinion about that. I mean, do you think we had enough time to really focus on the people in the city?
No, I don't, and I appreciate those calls for extended time. I have been one of those making that call. I would note that we are only at the beginning of this effort. And I believe that the state and the federal government joining us as a local community in having a sustained effort towards equity in all of its dimensions is the right thing to do. And I am not dissuaded by the fact that the decision on the 4th of March is to be wide open for all eligible folks in the region, and then to end the presence here. I am hopeful that we can continue a conversation, demonstrate by the efficacy of our local work, and make real through the dent of our advocacy effort a continued commitment to making sure that at the end of this vaccine initiative that we will have achieved equity in all of its dimensions, by race, by ethnicity, by income, and by geography.
Thank you, Atia. Brian Sharp from the DNC, you're up next.
I'm not sure who this would go to, but heard that there's plans in the works for community organizations to have allocated vaccination slots and then fill those, working with folks in some of these populations Mr. Norwood just talked about. Can someone address, I guess, where that planning stands and what number of appointments or folks we're looking at?
Who wants to? So,
Anna,
you're muted. Did you want to take that, or do you want me to?
Sure. So this is one of our plans to increase access. One of the problems that we've seen that's been a serious problem has been based on essentially the digital divide. It's been very difficult for people to make appointments. And not everyone has access to computers or phones or the internet. And we have been trying to really think about a lot of different approaches to trying to reduce this problem. And one of those was the idea of working with community-based organizations and allocating slots to them. This has already started. The Monroe County Department of Public Health site at the Convention Center has allocated some slots to Lifespan, a community-based organization that helps the elderly to receive services. We hope to continue to do this with other slots in partnership with other community-based organizations. In terms of the numbers, I have to leave that to Dr. Mendoza.
Yeah, and the numbers change to some degree week by week. We really want to listen to our partners and ask them how many they think they can handle, because we want to set people up for success. And so we are in the process of surveying all of our community partners who are interested and who have expressed interest in helping us to schedule, because that's how we think that we're going to meet the demand. We want to balance things as appropriately as we can. We don't want to over allocate to a group and deluge them with appointments that they're not going to be able to schedule. But we want to give them enough, recognizing that the supply, unfortunately, still is not quite up there with the demand. So this is an ongoing project. We really want to engage all of our partners across the community in this effort. And we think that this is a good way to mitigate the reality that the computer-based URLs that go out at 5 o'clock on a particular day don't meet everybody's needs.
Thank you. And for Dr. Mendoza, in the talk of reopening schools, I know personally we've been looking at getting our little guy back into preschool, and was told that the advice that you had given to the particular place we were looking at was that the kid would still be masked in the fall. I don't know if that has changed at all, or if you could describe what you expect for be it preschool or K-12, what those classrooms will look like versus now?
Well, as we've learned for the past year, we don't want to look too far into the future because things change so rapidly. Between now and September, I anticipate a lot of things changing. Number one is the vaccination rate in our community will greatly increase between now and then. I anticipate we'll know what effect, if any, these COVID variants will have on the pandemic. I think we'll have a good sense, and if last summer was any indication of how this summer will go, I think we'll have a good sense that the transmission rate can be kept to a very low minimum. And so then we have to choose as a nation, indeed as a country, how are we going to, pick between the mitigation strategies that we feel that we want to prioritize and look at those that we perhaps may be able to de-emphasize. I think the one that we all want to try to de-emphasize is the 6-foot distance. If there are ways to safely compensate for having less than 6 feet, then we want to explore those because that has been the primary barrier to reopening virtually all of our societies, schools included. So, if we had to choose, I would say masks would be in place if we had to reduce to less than 6 feet. And I think that would be supported by the evidence. The masks have been shown to be very effective. And we've seen this through all of our contact tracing. Now we've conducted over 250,000 contact tracing calls here in the county. And the experience has been very consistent that masks make a difference. And so if we had to choose which strategy that we would want to prioritize, I would say it would still be masking. Dr. Fauci and all the way on through the CDC, everybody has assumed that masking will be a part of our reality until well into the next calendar year. But my hope is that we can look at all the other mitigation strategies and see what we can adapt based on the science as it evolves.
Noelle Evans from WXXI is next.
Hiya. So my first question is for the vaccine, the Finger Lakes COVID-19 vaccine hub folks. So there is currently an outbreak at the Buffalo Federal Detention Center in Batavia of 51 detainees. As I understand, there is still court proceedings as to a vaccination plan for detainees. And I was told today by the NYCLU that one of these suggestions is that petitioners sign up specific detainees who are vulnerable themselves to get vaccinated. And so since this is within the region and since there is a push for equity, I just want to know what your thoughts are, if you have any comments.
Yeah, this has been a cause of great concern for us because prisoners have not been included in the eligible groups up until this time. And, to my mind, to put it simply, it's a congregate care facility, and we've been vaccinating other congregate care facilities. So I am really concerned about the prisons and detention facilities in our region. We have not had a plan because we've really been told that these populations are not yet eligible, but I hope that soon that will change. The eligibility criteria are expanding slowly but surely in New York State, and we're hopeful that this group will be included very soon.
Okay, and as a follow-up, Dr. Mendoza, I think it was last week, you had changed your tune slightly when it came to after someone is vaccinated, if they can be unmasked in the presence of others, whether those folks have been vaccinated themselves. And so given the news of the mutations or variants in the region, I'm wondering if you could just sort of clarify those comments and if any of that has changed for you.
Well, remember that these variants are still variants of the COVID-19 virus. And while the new variants may be more contagious, the fact is that the vaccinations have been shown to be effective against virtually all of them, with some exception to the South African variant, which is not here to our knowledge. All of the other variants have been shown to be effectively prevented by these vaccines. So my behavior wouldn't change. I think it's important to get vaccinated. I think it's important to understand, the risks involved in any interaction. But as I've said in the past, there is no zero risk path through a pandemic. And I think we have to be thoughtful and educated about the risks that each of us is willing to take as individuals and as families and as a community. But I think given the evidence available right now, I would not change that behavior. So if I was in the company of other fully vaccinated individuals, I still would not wear my mask.
Thanks.
Thank you. Patti Singer from Minority Reporter, you're up.
Hi, thank you. I want to go back to the Hawkeye situation. If I did my math today, it appears that 15,000 appointments went in a few hours versus 13,000 that it took more than a week to fill. Given all the barriers that some people are having with appointments, how will vaccine either be kept in reserve or made sure that because it seems to be going to take some time for certain populations to be able to sign up. How are you going to keep in reserve so that those populations are, I don't want to use the word guaranteed, but don't lose a place in line to somebody who's just more adept at a keyboard?
Patti, I would not deign to try and speak on behalf of the state on how they are going to operationalize holding that amount in reserve that they're committed to doing so. So I defer that question to them. I would take the opportunity, however, to really note that I see that the work that we're doing, you're exactly correct. It will take a couple of days for the impact of those outreaches to translate into actual clicks in registration. And so it is why my earlier statement affirmed my interest in making sure that, number one, we have adequate supply in the community. Number two, that we make sure that we have vaccination sites that are accessible to the least resourced among us. And number three, that we really need this partnership of the clinical world, the hub, and the community to continue, because we will continue to need the assisters that are supporting folks getting registered as much as we will need the help of 311, 211, and RTS to make sure that the transportation barriers are as low as they can possibly be.
As a follow-up, last week I harped on the lack of numbers from the state and zip code level for diversity to make sure that we are having some equity. How do you think that if we don't start getting those numbers, that it's going to be acceptable for the state, or that people are going to be left behind because now we still don't know what our numbers are in these vulnerable communities? How are we trying to track a vaccine that is for these vulnerable people and the actual delivery to these individuals, the availability and the delivery?
As the regional health planning entity and our prowess with regard to data, thank you very much for allowing me to always have a response on the matter of health data for community planning purposes. When we addressed this the last time, we understood that there would be several stages involved in the receipt of the raw data from the state, in the analytics of that raw data, to be able to move it into a form that would allow us to truly link it to meaningful measures around race, ethnicity, and geography. And then it would take us another step of analytics to really be able to determine the integrity of the data and understand how to share it and communicate its strengths and its limitations. In that multi-step process, Patti, I am delighted to affirm that we have passed through gate number one, that the data has arrived. And as gates 2 and 3 are passed through, Dr. Bennett and I will be absolutely prepared to share and respond in detail of what that data is showing and how that data is actionable information. But I would not expect our ability to be at that stage prior to the 1st of next month.
Well, all right, thanks.
Thank you, Patti. Our final question today comes from Tanner Jubinville from 13 Lamb.
Hi, good afternoon. I want to ask Dr. Mendoza my first question. Dr. Mendoza, can you talk about why it's important to keep, closely studying these new cases for these mutations and variants? I mean, even if the vaccine is, known to be effective across the board at this point?
Well, I would say that it wouldn't be responsible not to. I think we need to understand what we have before us so that we can ensure that the recommendations that we're making are on the best available science. I do think it's important, though, to put all of the science in perspective. When we hear these isolated reports, I think it's very easy for anybody among us to draw conclusions prematurely. And so we want to rely on the CDC and respected scientists to take a look at the entire weight of the scientific evidence and draw some reasonable, valid conclusions that are accurate as of the time that we make these conclusions. So I think it's important to look. I think we need to understand what's going on because I don't think it would be responsible to the public to not be transparent about the things that we know about. But based on what we know, I think there is no reason for alarm right now. I think we need to follow this and ensure that the vaccines are in fact effective against them. But we also have to balance that against the real risk, which is that if we're too hesitant and we're too timid and people don't get their vaccine, that has real consequences too. So we're not looking at, again, a zero risk situation. We've got to make choices between two situations that are evolving and to some degree not ideal.
Thank you. And a follow-up I have is for probably more geared for Dr. Bennett. Talking about vaccinations in rural areas, can you discuss, is there any conversations happening locally or regionally about efforts for outreach to rural communities, things like maybe pop-up clinics or things like that?
Yeah, thank you for that question. Just to add one comment to what Dr. Mendoza said about the variants, it is important to highlight his comment that these variants have probably been with us for quite a while. And the testing for variants has been a little less than we would like to see, and that's ramping up right now in a major way. So we are likely to hear about more variants in the near future because of the increase in testing. And, I don't think that I completely agree with his comments about not changing anything we're doing at the moment. There's really not cause for alarm, but just anticipate that you will hear about this more and more. With respect to vaccination and outreach in the rural regions, yes, we have had a couple of pop-ups already, and there is one this weekend in Livingston County. In addition, the Batavia site was established by New York State specifically based on the fact that the vaccination rates in those western counties are a little bit less than they are throughout the rest of our region. We're also aware when we look at the map of our region that the farthest areas from Rochester are looking like they have slightly lower vaccination rates. So there's a lot of interest in addressing those. And we have both local health departments in the surrounding counties and also federally qualified health centers that have been very aggressive in reaching out to patients throughout the region. So we have a lot of work to do, but I think we have the capacity in place. And as the supply increases, I think we'll see that our surrounding counties will be very successful in vaccinating their citizens.
Thank you, Tanner. We have no more questions. Any closing remarks?
Just real quick, I want to just touch on something I didn't before. We're still in a rapidly developing situation, particularly as it comes to vaccines. And I know the community's been very patient as the vaccine rollout has taken place. We've all had to be very patient as well, hoping to get additional vaccines to meet the need. But to bring some perspective, because perspective is everything, just a few months ago when the vaccine first came out, we thought we'd be vaccinating people and really working through the first dose of vaccine through the end of the year, even into next year. Then a couple weeks ago, we were told there would be enough vaccine to hopefully get through the population by early summer. And then earlier this week, now we have good news with the J&J vaccine and the news out of the White House that we may have enough vaccine to get to everybody by May or June. And so I think that is all just really good news, but also, again, underscores the rapidly changing nature of the vaccine, but also of the whole pandemic and how, and just that the ebbs and flow of information and how things change. And so I just want to thank everybody for their patience in working through this, and also the media, because as we get additional vaccine, it's important to get information out to people as quickly as possible because the situation changes almost on a day-to-day basis. I'll go back to what I said before. We're notified weekly on how much vaccine that we have coming into the region and into the county. And so it makes long-term planning a challenge, but also requires us to be ready so that when the vaccine is here, we are ready to go. So these kinds of conversations are just critically important to have. So thank you all very much. Thank you, Dr. Bennett. Thank you, Dr. Mendoza. Thank you, Wade. Norwood, for your partnership and for getting this information out. We look forward to seeing you all again next week.
Thanks, everyone. Bye.